Hello, everyone. This is Dr. Siddharth Tambar here at Chicago Arthritis and Regenerative Medicine. Welcome to our webinar today. Today, we are talking about our physician-assisted weight loss program with semaglutide and other peptides, and we are going to be touching on a few different things. I've got a few slides to present. Please enter in your questions, and I'll try to answer them as we go along. So today's talk, we're going to talk about our signature weight loss program. We're going to be talking about peptides, lipotropics, and health coaching. All keys to help out in this process. So obesity, the scope of the problem is obviously immense. Global health concern, really impacting so many different things about cardiovascular health, metabolic health, immunologic health, overall well-being. Obviously, in my practice, I see so many people with arthritis, in particular backs and lower extremities, and this definitely impacts that significantly. The number of people categorized as obese, according to World Health Organization, this is as of 2016. So this is quite an old figure. It's about 650 million people. In the US, these numbers as of 2020 are about 42% of adults and almost 10% of children and adolescents. And so, what we're trying to talk about is how can we improve things, because we're really failing in this regard. So there are a lot of health effects of obesity. Again, musculoskeletal problems are things that I see every day. So that's what I'm kind of always focused on. Obviously, cardiovascular consequences in terms of high blood pressure, heart disease, metabolic effects such as type 2 diabetes, hypertension, immunologic effects as well. It actually does kind of worsen some autoimmune conditions. It can increase chronic inflammation, it can also increase risk of various cancers, and even risk the chance of sleep apnea, which then in turn increase the risk of cardiovascular disease. So we need better weight loss solutions. Number one, because it really impacts so much of our lives and health spending and society. Number two, the traditional methods are generally not really adequate. We all know diet and exercise is key, but does not seem to be really adequate for a lot of us here in the United States. Conventional weight loss strategies have not really given very great, consistent results. And even if they give results short term, they tend not to really work in terms of maintaining weight loss long term. And that's due to real complex interplay of biology, psychological, environmental factors. So we're really trying to hit on every single one of those things. So our goals of treatment are really multifold, right? We are trying to reduce body fat, improve muscle mass, and reduce visceral fat. And in so doing, improve cardiovascular risk factors, metabolic risk factors, exercise capacity, even eating habits, immune and gut health, and of course, sleep and stress management. So there's really three ways that diet can help with weight loss. Number one, you can just eat less calories, meaning if you have greater output in terms of energy and less input, you'll lose weight. Then the question is, well, what types of foods? The reality is that the guidance when it comes to what foods to eat is really all over the map. When you look at medical societies, they generally recommend more of a Mediterranean diet, whereby you're doing more legumes and vegetables, fish and chicken, minimizing red meat, highly processed foods, and lots of carbs, right? We're really minimizing those kind of bad things. But, when you look at how people are eating in America, it's all over the map. You see people who can be anywhere when it comes to weight loss, who'll be doing full-on vegan to people who are full-on carnivore, and so many things in between. So, what foods should we be eating less of is a little bit vague, but I think the Mediterranean diet concept is sound in that it does try to avoid a lot of the bad things. And then, of course, there's eating during specific periods of time. Intermittent fasting has gotten a lot more popularity in the last 10 to 20 years. Makes a lot of sense. The challenges and intermittent fasting really means that you're only eating certain blocks of time. So the most popular one is you're fasting for 16 hours and eating for 8 hours. So for example, it would mean your first meal would be at 10 a.m. and your last meal would be at 6 p.m. and you're fasting the rest of the time. There was a study that was not published, but sort of brought up in a medical meeting where they looked at, are there higher rates of heart disease if you're doing intermittent fasting? There may be some suggestion of that, but the reality is that that's really, there were a lot of variables that they didn't account for in that study. So, but the main thing is that diet is important, but it's probably more than just one of these individual three things. It's really trying to do all three of these things, trying to reduce the total amount of calories, limit certain types of foods, and then trying to avoid eating, let's say, really late at night as well. If you can do all those kind of things, that's where nutrition gets really helpful. That can be hard to do, in large part because each one of these things takes a lot of effort and willpower to do. So peptides are really a innovative new therapeutic tool for weight loss. So peptides are naturally occurring molecules or proteins that basically signal your body to do different things. So they're essentially proteins in your body that tell your cells what to do. So the most common one from a weight loss standpoint is glucagon-like peptide. It's a naturally occurring peptide or gut hormone that basically regulates your appetite, your insulin secretion, and energy metabolism as well. There are other peptide targets as well. So semaglutide, or more commonly known as Ozempic and Wegovy, targets GLP-1. There are other types of peptide targets as well. There's tirzepatide or Zepbound that targets two different receptors. There's retatrutide, which is a newer peptide that's currently in development that affects three different receptors. The point here is that there's different ways to kind of get at this, and medicine is improving how we do things. So all these peptides that we're talking about in this realm, they have a key role in not only your blood glucose homeostasis, insulin secretion, which helps to regulate your blood sugar, helps reduce your blood sugar as well. It has a key role in blood glucose and thus diabetes, and also in metabolic health. What they found is that these kind of medications also help with weight loss as well. So peptides are really a potential game changer in weight loss. So semaglutide is one that's really been tested and that's been observed the most. And again, it specifically targets one particular receptor. It's been demonstrated to really dramatically improve weight loss and improve metabolic health. So how does it work? It improves your overall blood glucose homeostasis by getting more blood glucose into the muscles, reduces your overall kind of movement of food through your gut as well, so you're not as hungry as fast. It also reduces your appetite. There are certain chemicals or neuropeptides after you've eaten that increase so that they make you less hungry, and there's certain peptides that decrease, kind of reduce your hunger as well. And so semaglutide helps to mimic that as well. So the two ones that we're generally using right now are either semaglutide or tirzepatide, and they work because they help to control your appetite, and that's done through slowing your overall body's transit of food through your stomach and gut by reducing your hunger sensations, helping you to feel fuller sooner, reducing your food cravings, reducing even certain food preferences that may be not good for you, reducing your thoughts for food as well. So what are these kind of medications approved for? So these are FDA approved for both type 2 diabetes as well as chronic weight management in adults. Specifically, when it comes to weight management, it's for folks who have a BMI over 30, or also people who have a BMI over 27, with at least one weight-related comorbid condition. So that includes things like high blood pressure, diabetes, cholesterol, wear and tear arthritis, fatty liver, prediabetes, heartburn, if you've got PCOS, hypogonadism, or asthma. So really a lot of different things. And what's nice is that because it's not just about using it in a BMI greater than 30, you're really catching people who have all those other kind of weight-related issues that would benefit from treatment as well. Other potential future preventative indications could include possibly cardiovascular disease, pre-diabetics. There's some evidence that it actually helps in neurodegenerative diseases, and as an anti-aging treatment and for metabolic syndrome. So it's very early days for these kind of treatments. We're very focused on weight management, diabetes, because there's multiple years of treatment for those kind of conditions, but really this is going to expand to other things as well. So in terms of treatment protocol, the dosing is a weekly injection that you give yourself. You start on a low dosage and you escalate monthly as needed. So we start on a low dosage because a very common side effect is some nausea and abdominal discomfort. And you really want to make sure that you're tolerating it before you start increasing the dose. So essentially, we're monitoring you on a monthly basis, your weight, your appetite, observe for any side effects, and monitoring your metabolic health labs roughly every 6 months. Purpose of that last piece is that, number one, we want to make sure we do this safely. We want to make sure that you're not getting nutritionally depleted in any way. We want to make sure you're being supplemented the appropriate way as well. So when you look at the results in clinical trials for semaglutide and tirzepatide, I mean, the results are really quite tremendous. For semaglutide, on average, when they look at people who take this, the weight loss is roughly 15 to 20%, and that's maintained long-term if people are continuing the medication. Tirzepatide, again, it's about 20%. So, I mean, these meds are exciting because, number one, they work well. They have less side effects than some of the older weight loss medications. Number two, if you combine them with good nutrition and regular exercise, you're going to get not only a better result long-term, you're also going to get longer lasting results as well. Again, safety profile looks very good. The main side effect is some GI side effects. There are some rare other side effects that can occur, like allergic reactions. If you have a history of, let's say, active thyroid cancer, you wouldn't want to be on these kind of medications. But otherwise, they tend to be fairly low risk. And that's when you're looking at data that goes over 2+ years now. Lipotropics, that's the other thing that we are starting to utilize for weight loss as well. So lipotropics are substances that essentially help in the breakdown and metabolism of fat in the body. So these include various vitamins, supplements, and amino acids. The ones I've listed below are some of the more common ones that are utilized. There's a number of different benefits for this. Number one, it can improve your energy level, in particular if you're low in B12 or B6. It works also by detoxing the liver. It can aid in weight loss, which is obviously what we're talking about today. Improve heart health, enhance mood and mental clarity, support hormone balance, boost immunity, and improve joint health in some studies. This works by, essentially, it's a collection of all those substances. You essentially inject yourself on a weekly basis, intramuscular. We find that if you combine this with peptide treatments, you can get an even better benefit. You can also use these individually on their own as well. They work by mobilizing fat from adipose tissues, by enhancing the liver's ability to metabolize fats, by supporting the liver to effectively function and process and remove fats and toxins from the body. It's also helpful from a cholesterol level standpoint because it helps to convert your cholesterol into bile acids in the liver, which then gets excreted into the gut as well. So has a lot of benefits that I think are really interesting, probably milder as a standalone treatment compared to the peptides, but an interesting idea of combining with peptides as well to really maximize weight loss. Health coaching is the other thing that we are starting to introduce to patients. We've started to work with a company called Flare Health. They offer a nutritional health coaching program. They're focused on really 3 different ways. What we know is that I think everyone knows, hey, eat healthy. Sometimes we're not really sure exactly what that means. And sometimes we're not sure how to actually do that. And so education is a big part of it for a lot of folks. The other thing is accountability. I think it's easy to want to do something. I think it helps if there's some accountability, and coaching is very helpful in that regard. And then the last bit is, the reality is you can know what's right to do, but to create a new habit, it takes, depending on the study, can take about 60 to 90 days of doing it very diligently every single day. And that's kind of true for everything. That's whether you're trying to do a new exercise regimen, a new nutritional diet, a new habit at home or at work. It really takes really consistent diligence to do that. And I think health coaching is a nice way to help to maintain that. And so we're kind of excited to also introduce this as another option to help aid our patients in trying to get that kind of good result long-term. So really the keys to optimized treatment are as follows, at least from our standpoint, from a medical weight loss standpoint. It's to look at how do we utilize peptides, lipotropics, exercise, and nutrition will help the most with weight loss. From a nutrition standpoint, the key is to eat nutrient-dense food. You want to avoid overeating. From an exercise standpoint, it's doing both cardiovascular exercise to assist with weight loss and to improve your metabolic health, and to also focus on strength training to help protect you from muscle loss as well. The stronger the muscles are, the more you can maintain your muscle mass as well. Not only are you more stable and stronger, but you'll actually help with weight loss as well. The one thing that we know about weight loss is that as you're losing weight, your body doesn't differentiate between losing muscle or fat. And so you have to be very conscientious about what you're eating to maximize strength. And you have to be very conscientious about exercise to make sure you're maintaining muscle mass as well. Frequently asked questions that I get from patients really include the following. So number one, how long do you see weight loss? You should notice some early weight loss even within the first month. But what we tell people is that, look, you start slow and you progressively increase the dosage of treatment. And so there's this initial phase where you're scaling up for that first 3 to 4 months. So you start on that low dose, make sure you're tolerating, escalating as tolerated, but you will be noticing some weight loss even within that first month. How much weight can you expect to lose? When you look at the studies, on average, it's 15 to 20% of whatever your weight is. Now, the reality is, if you do everything else correctly, in terms of lifestyle changes and all that, you can lose more than that. So how long do you need to continue treatment? What we tell people is an initial period, think that you'll be doing this for at least 6 months. And the reason why is, this takes time. We really don't want you to lose weight too fast. Like that's not healthy either. You need to be doing this slowly and progressively. So we tell people start for at least 6 months to see how well you do. When you look at the studies for peptides, whether it's semaglutide or tirzepatide, they are most effective for chronic weight loss management. And what that means is the studies that are out there, people are taking this long-term. Now, for people who are taking this long-term, once you hit your goal, you can certainly be taking a lower maintenance dose, either a lower dosage per week or less frequently. Maybe it's every 2 weeks, every 3 weeks. So there's still some benefit to taking this long-term. There's safety taking this long-term as well. You may not necessarily need to take the full dosage once you hit your goals. And then also keep in mind, depends on what else you're taking it for. So for example, let's say you have fatty liver or you have some chronic inflammation. Well, if this helps manage that as well, you may be taking this long-term as well for those issues also. So do you need to be eating healthy and exercising when using these medications? This is the kind of question that, my daughter is 10 years old, and I think it's the kind of question that a little kid would maybe ask, right? Like, of course, we all know as adults, yes, you need to be eating healthy and exercising regardless, right? Whether you're trying to lose weight, whether you're taking medication, you should be doing that. But certainly when you're talking about treatment for weight loss, yes, combining these treatments, peptides, lipotropics, along with exercise and nutrition will give you a more optimal result. Also keep in mind that the peptides, what's nice about the peptides is that they help you learn, they help you establish a new habit. You know what you need to do to get things correctly long-term. It's sometimes hard to maintain that and develop that habit and maintain that habit. And so these kind of treatments of peptides will actually help with that because they take away some of the craving sensations to do sometimes those incorrect things that are not good for you. So can semaglutide make your muscles and bones weaker? So I mentioned this before, but note that weight loss will result in fat and muscle loss. Like when you lose weight, your body doesn't necessarily know, do you lose fat or do you lose muscle? So you need to improve, you need to really focus on improving your body composition. And the way you do that is by doing the right exercises and optimizing your nutrition. If you do that, you'll maintain your muscle mass, you'll maintain your body composition, you'll improve your body composition. And by doing that, you'll actually even help your bone health. The more muscles and stronger your muscles are, the more your bones are strengthened as well. Question that I've heard from other folks as well, I already don't eat much, will treatment help? It's a good question. 2 ways to think about this. Number one is, with peptides, we're trying to improve your overall metabolic health as well. And what happens with that is it helps your overall metabolism as well, which is key. You can eat less, right? But sometimes your metabolic health is still not right. I think for anyone who's noticed that after the age of 40 or 50, you start to find that the kind of things that you could eat in the past, you can't do any longer because your metabolism has changed. These kind of treatments do help with that aspect of this as well. The other thing to keep in mind is that if you find that your level of appetite is dropped too low with peptides, number one, you can adjust the dosage so that it isn't inhibiting your appetite too much. Number two, there are lipotropics that do not actually affect your appetite. That's more about just improving your metabolism, right? So it's another way of treating this as well. So depending on sort of what your issue is, what you've responded to in the past, what you haven't responded to, a targeted and sort of personalized approach to what works for you can be kind of figured out. Another common question, if I stop weight, will I regain all the weight? So studies show that if you completely stop semaglutide, that's the one that's been tested. And if you stop all your healthy nutrition and you stop exercising, well, then eventually you're going to regain about 2/3 of the weight loss that you've had. So a couple things here. Number one is it's interesting that in the studies show that you don't actually regain all the weight back. That's kind of interesting. Your body is sort of adjusted to that. But number two is you should be maintaining good nutrition and exercise long-term. Again, this is one of those common sense things that, yes, if you stop good nutrition and exercise, you're going to screw yourself in all the hard work that you've gone through. So would definitely recommend maintaining your nutrition and exercise if you stop peptide therapy. And then also keep in mind that peptide therapy can help long-term. So should you use peptides long-term? You can. The data shows that it seems to be low risk. So from a safety standpoint, when you're looking at 2+ years out, it seems to be something that's helpful. Again, this will help you maintain your weight loss and metabolic health. And again, a maintenance dosing can be lower dosage or frequency. Then lastly, how do peptides compare to other prior weight loss meds? So we're not talking about lipotropics here. Lipotropics are very low risk. They don't have a lot of side effects. They help with your overall sort of burning of fat, but they don't really have a lot of side effects. The older weight loss meds had a lot of other side effects. Either people were developing diarrhea frequently, or some of the other meds, they would really ramp up your metabolism, but they did it in a way that also put people at risk for heart issues as well and arrhythmias. So what's nice is the peptides, semaglutide, tirzepatide, number one, they're really utilizing your body's normal process of trying to control metabolism as well as hunger. And the lipotropics, again, don't really have any of those other kind of side effects as well. So these treatments are lower risk than some of the prior treatments, and they're more effective and more consistent in weight loss and seem to be relatively safe if used long-term as well. Okay, great. So just a little bit more about sort of the program that we're offering. So physician-assisted weight loss program, again, offering a personalized approach to weight management, utilizing the efficacy of peptides and lipotropics. And I would also say health coaching, now that working with Flair Health. First starts off with a proper evaluation. Make sure that we know what your actual medical history is, what your weight loss goals are. Are there any contraindications? How do we do this safely in your case? Then doing this with me and my team, experienced clinicians guiding you through the entire process. Again, providing a personalized approach and making sure this is done safely. From a physician end, it's always first and foremost, do no harm. And always first and foremost, make sure that what we're doing is going to be low risk and safe for you. And if we're using things that are more interventional oriented, make sure that we're monitoring you appropriately and closely. And so close monitoring your progress, making sure that we're adjusting your treatment plan as needed to optimize your weight loss efforts. What I find sometimes for folks that have taken, let's say, Ozempic in the past and have found that they haven't really sufficiently lost weight, when you ask them, it turns out they really only increased their dosage a couple times, and then they just stopped. For some reason, their physician did not keep on going up on it, which probably would have helped them to lose more weight. Or I found some folks who said that they didn't tolerate the medication. Well, maybe they increased it too fast. Maybe their body had to slow it down, or maybe they didn't have to go at such a high dosage. Or maybe they didn't tolerate semaglutide as well, but why didn't they try tirzepatide, which doesn't seem to have as much GI side effects? So, I found that, being able to adjust things on the fly is really a key way to kind of improve things, certainly as a physician and for patients. And I think for these kind of treatments, that's important as well. And the last, again, I mentioned before, is regular lab monitoring. Recommend doing that every 6 months, once at baseline, to make sure everything is sort of safe and appropriate as we start, and then checking every 6 months to make sure that you're being managed in a safe and appropriate way. So again, our personalized physician-assisted weight loss program utilizes the efficacy of peptides and lipotropics. Peptide therapy, if you're starting with semaglutide, starts at $450 per month. Lipotropics start at $150 per month. We do have bundled pricing if we're combining things. That includes actually for the health coaching as well. And this all includes medical monitoring, medication, and supplies. To learn more, you can either go to the website, chicagoarthritis.com, or you can also click on the QR code there, and that will take you to the same page as well. If you have any questions after this, number one, you can obviously reach us either through the website, through email, through calling us, or you'll get an email actually just to kind of rewatch this if you'd like to kind of hear this again, or if you'd like friend, family, or coworker to learn more about this. And we are available to help guide you through this process at any time. Wonderful. Well, before we close up for the day, please let me know if there's any other questions. Okay, wonderful. Well, listen, everyone, thank you for your time today. Until we connect again, I hope everyone stays safe and stays healthy. Have a good day and live well. Bye-bye.